Hi everyone, Dr. Luke Peterson here, physical therapist with a knee replacement therapist. In this episode of the Need to Know Show, we're going to talk about age and how it relates to knee replacement surgery. Is there a right age to have surgery? Can you have surgery too young? Can you have surgery too old? We're going to deep dive into this and take a closer look. Today we're talking about age and how it relates to knee replacement surgery. This is a really common question that I get. People are asking me, is there an appropriate age or the right kind of spectrum of age to have a knee replacement surgery? Can you get a knee replacement surgery too young? Can you be too young for surgery? Can you get a knee replacement too late or when you're too old? Really good questions and really common questions that I get. So first of all, let's look at just generally speaking. So the average age for a knee replacement surgery is right around 65 years old. And that's about the same for men and for women. So obviously there's a group of people who are younger than that. There's some people who are a little bit older than that. But on average, it's right at about 65 years old. Now, some different research studies and reviews and things that try to determine appropriateness for knee replacement surgery or not, some of them will set the age at 55. So if you're younger than 55 years old, then it wouldn't be a good time to have a surgery. If you're 55 or older, then you're in that appropriate time. I've also seen a study that set the age at 50 years old. So if you're 50 years old or older, then knee replacement surgery is appropriate. But in reality, these are kind of arbitrary numbers. Especially now, there's an increasing rate and an increasing amount of people who are in that younger age group. So thinking about maybe that 40 to 50 years old or 40 to 55-year-old age group who are getting more and more common to see people getting knee replacement surgeries at that age and individuals having surgery then. So that age group that's a little bit younger is increasing more and more. And you even see some people who are in their 30s or in their 20s even who have knee replacement surgeries. Now, a lot of times for those people who are much younger, 20s or 30s having surgery, a lot of times there's some underlying reason for that. So some sort of systemic condition or disease or some sort of congenital thing that now has caused an amount of deterioration of the knee or the mechanics and the structure of the knee that knee replacement surgery is kind of the only solution or the only thing that might help. So that case that's out there as well. That's not necessarily the majority of people, but there are people who have that certain situation where they have something just besides your standard arthritis, deterioration of the cartilage type of thing. They have something a little more involved, which might warrant a knee replacement earlier. But let's talk about that age group, 40 to 50 years old, 40 to 55 years old. Why is that amount of surgeries in that age group increasing? There could be a bunch of different reasons. So one is just the American westernized lifestyle. So increasing rates of obesity, putting that stress and strain through the knee, as well as the biological and inflammatory processes that occurred when you're obese or overweight. We also were talking about people have different options. So it's not just a total knee replacement. There's things like a partial or a uni-compartmental replacement. There's minimally invasive surgeries and the same-day outpatient surgeries. So there's certain choices that are less invasive and that afterwards you're able to still do quite a bit of activity. So some younger people might lean toward or be directed towards those options of knee replacement surgery as well. And I think just in general, the longevity of a knee replacement has been increasing. A lot of times you've heard back maybe 10, 20 years ago that the lifespan of a knee replacement, 10 years, 15 years, maybe if you're lucky, maybe 20 years. But I think now and more, the average and the expected life expectancy is closer to 20 years, reaching up to 30 years long that you can have a knee replacement. Obviously, there's going to be a lot of variability there, and some people are going to not have it last as long as that. Some people might have it last a little bit longer, a lot of variables. But more and more, they seem to be lasting longer overall. So why do we worry about getting a knee replacement at a younger age? Why don't we just get a knee replacement and, it's going to help decrease our pain, increase mobility, increase function. So why not just have a knee replacement surgery? Why do I have to wait till I'm older? Or why do we try to wait till the person is a little bit older? Well, the reason for that is if your knee replacement fails, loosening, infection, breakdown of the knee replacement, then you're going to need a revision knee replacement surgery. Revision knee replacement surgery, they're getting more and more effective. Surgeons are getting better and better at them, but at the same time, it is a very involved surgery. You actually have to remove the prosthetic and the replacement that's in your knee, which takes a lot of work, and you might have to remove a little bit of the bone and some other things with it, and then form and place the new replacement on it. So it's a little more complicated surgery. And with any surgery, such as a serious orthopedic surgery, there's risks for complications, there's risks for things, and then of course you have to go through that rehab process. The rehab process after a revision isn't much different per se between a normal first-time knee replacement and a revision, but you're still going through that process and that rehab a second time, or maybe even more than that. So that's things that you have to keep in mind. So we want to reduce the risk of a revision knee replacement surgery if we possibly can. Now, so the thing to think about is really it comes down to weighing those pros and cons. So you want to look at, how bad is your knee pain and your knee symptoms affecting you. If it's something that's in this low to moderate level and you're able to manage it effectively and you've gone and you've tried conservative management strategies and those are helping and working well, then the advice is going to be to stick with those conservative management strategies as long as you possibly can. If it's not seriously impacting your life to this tremendous extent, then why don't you wait, give it as much time as you can, put it off as long as you can, wait till your age where you're a little bit older, and hopefully you only have to get the one knee replacement in your lifetime. But if you're someone who, the pain is extreme, it's constant all day, all the time, you have stiffness and swelling and all these problems, and you're not able to do the things you like. You can't even walk without pain and discomfort or sit in a chair. Doing the simple activities and the things you enjoy in life are just painful and you're unable to do them, then it might get to that point where it's worth it for the improved function, the improved quality of life, the improved just well-being and happiness of you as an individual, that you say, okay, I'm a little bit younger, I'm maybe in my 40s, maybe in my early 50s, but maybe even younger, but having the benefits of decreased pain and being able to do the things I enjoy and the things that make me happy and doing those with the people who, my friends and my family, that's more important to me than that increased potential of possibly needing a revision or more likely needing a revision surgery down the road, So it really comes down to weighing those pros and cons. There's no one correct answer for everyone. You really have to look at it individually. You have to, I recommend talking with your physical therapist, talking with your surgeon about the pros and cons. Make sure you're trying the conservative treatments that are out there and really giving them a good try. There's a lot of things out there that can be beneficial. And at the top of the list is physical activity and exercise in the long term can be very beneficial for symptom relief, pain relief. You have to give it a good try. You have to give it a good, 1 or 2 times, and, it hurts and you don't want to do it anymore, isn't going to be beneficial. You really have to give it a good 4 weeks or 6 weeks of continuous consistency of exercise, physical activity to really see if that will benefit and help you. So the answer comes down to your personal decision. If you can put off knee replacement surgery till you're a little bit older, into your 50s, even into your 60s, or even a little bit more than that, that's probably going to be the best thing that you can do. But at the end of the day, if your symptoms are so intense and impacting your life so much, then it might be appropriate and it's perfectly okay to potentially have a knee replacement surgery at a little bit younger age, knowing the risk of needing a revision surgery down the road. So hopefully that helps kind of clear up this discussion and question, gives you a better idea of how to think about age and what's appropriate, what's not appropriate, why do we care so much. Be sure to subscribe. I post videos about all things related to knee replacement surgery. Thank you very much, everyone. Leave your comments, leave your likes. Share this video with those who might have the same question. Thank you very much for watching, everyone, and take care.